Hi, this is Dr. Carey Hemmelgarn. I want to introduce you to Module 2 of our toxicology course. It's going to be on triaging and decontamination of our veterinary patient. Once a patient has been assessed as cardiovascularly stable, or you have stabilized the patient, decontamination should be considered. Each patient is unique and each toxin is unique. Emesis should be considered if the toxin was ingested within 2 hours of presentation, or if it's a toxin with a high level of toxicity up to a few hours past ingestion. Emesis is induced in these patients that ate it a few hours ago and hope to remove that you may remove anything that might still be in their system because of how toxic this substance is. Emesis should not be induced in patients who have consumed a strong alkali or acid due to the concern of corrosive injury when they're bringing it back up on their esophagus. A patient also needs to be neurologically appropriate with a gag reflex to induce vomiting. The concern if we induce vomiting in a patient that's not neurologically appropriate or doesn't have a gag reflex is that there is a high risk that they could aspirate their vomit into their lungs, which we want to avoid at all costs. If a patient is at all neurologically impaired, emesis should not be attempted in them. If a patient has consumed zinc or aluminum phosphide rodenticide, emesis should be done in a well-ventilated area, and caution needs to be taken with the care staff that's taking care of them for the concern that this rodenticide creates phosphine gas in the stomach, which can cause human injury if inhaled. And so there is a concern that if we induce vomiting in these patients in a closed area with not good ventilation, that us as veterinary professionals could inhale phosphine gas and cause injury to ourselves. Recently, there was an FDA-approved ophthalmic drop that can be used. It's called ropinirole. It's a dopamine agonist, and it's been able to show that it is reliable in inducing emesis in dogs. And so if it is a difficulty getting apomorphine, or you want to use something that doesn't involve injectable medications to induce vomiting in dogs, ropinirole is a very good option to potentially look into putting into your clinic, in which you can use eye drops put into their eyes to induce vomiting in dogs.
The effectiveness of Clever was demonstrated in a clinical field study in which it was administered to 100 client-owned dogs to induce vomiting of the last meal the dogs ate. No harmful objects or toxins were given to the dogs. The study demonstrated that Clever is effective for the induction of vomiting in dogs, as 95% of dogs treated with Clever vomited within 30 minutes. 86% of the dogs in the Clever group vomited after the first dose, and 14% needed a second dose 20 minutes after the first dose was administered. Half of the dogs vomited within the study within 10 minutes, with 3 minutes being the fastest.
You can get this compounded to whatever concentration you want from some of the more common compounding pharmacies. The dose is 0.02 mg per kg up to 0.04 mg per kg IV, and the emesis should occur within 15 minutes of ingestion, and you can repeat the dose up to once. There's also apomorphine tablets that can be dissolved in saline and then given in their subconjunctival sac in their eye, but it's easier if you give them injectable medications. Hydrogen peroxide can also induce vomiting in dogs, but carries higher risks. Giving hydrogen peroxide, there's a risk of aspiration, as well as dogs not willingly wanting to ingest hydrogen peroxide and potentially them fighting that and increasing the risk of aspiration. Hydrogen peroxide has also been shown to cause gastroduodenal ulcerations after administration. There was recently a study that compared gastroduodenal ulcerations in a study population of dogs. All dogs that were administered hydrogen peroxide had evidence of gastric ulcerative lesions, and some had duodenal lesions, whereas all of the dogs that were given apomorphine in the study population of dogs did not have any ulcerative lesions. Another study we can talk about is one that compared apomorphine compared to hydrogen peroxide, which showed a higher success rate with apomorphine of 94% compared with hydrogen peroxide, which only had a 90% success rate. Due to the risk of aspiration pneumonia with hydrogen peroxide and the risk of gastric duodenal ulcerations, inducing emesis with hydrogen peroxide is not readily recommended if there's other options available. That would be using something like apomorphine. The next thing we're going to talk about is a little bit more difficult, which is the safest way to induce emesis in cats. The safest way is through injectable medications. We'll discuss what 3 options there are available in cats, which are all injectable medications. Cats should not be given hydrogen peroxide to induce vomiting due to their risk of aspiration, but also, unfortunately, cats can develop necro-ulcerative gastritis as a sequela post-administration of hydrogen peroxide. So cats should not be given hydrogen peroxide to induce vomiting. Our 3 options for injectable medications to induce vomiting in cats is dexmedetomidine, xylazine, and hydromorphine. We're going to talk about all 3 of those and break down pros and cons. Dexmedetomidine is consistently known to induce vomiting in cats in about 81% of time compared with xylazine. Xylazine was not as successful in cats, in which they only produced the cats vomiting in about 40 to 60% in a study population of cats. The median dose in this study of dexmedetomidine that was used in cats that was successful in getting them to vomit is about 7 milligrams per kilogram, and that dose could be given either IM or IV. The most common adverse side effects noted with dexmedetomidine was sedation. There's another study that compared hydromorphine with dexmedetomidine. So we're going to talk about whether you would use one versus the other one in that one, and that's what this study was designed for. So in that study, they found that there was a higher percentage of cats that vomited with hydromorphine at 75%, compared with dexmedetomidine, which was only about 58% in cats. Less sedation was noted with hydromorphine compared to dexmedetomidine, and less bradycardia was noted when using hydromorphine. So in those cases, that's something that hydromorphine, if available in your clinic, would be a good alternative to dexmedetomidine in cats. And if you don't have dexmedetomidine or hydromorphine, then xylazine may be something to consider in cats. Hyperthermia was one noted side effect with cats that were given hydromorphine, but that it was self-limiting and did not need further care after that. Once emesis has been induced in cases where it's recommended and safe, further decontamination mechanisms should be discussed. So we're going to talk about ways to further decontaminate your patient. Activated charcoal is commonly recommended based off of the toxin's ability to absorb the toxin in their GI tract. So what activated charcoal does is that the goal for it is to absorb toxins so they can be moved through the GI tract without being absorbed, and therefore they're more safely eliminated. Sorbitol in charcoal formulations acts as a cathartic to speed up GI transit, and with multiple doses can cause diarrhea and electrolyte derangements. Cathartics containing activated charcoal should only be given once, and then subsequent doses of activated charcoal, if recommended, should not have sorbitol. Activated charcoal can be mixed with a small volume of food and fed to the patient if it will eat it readily, such as our Labrador retrievers. If they won't eat the charcoal readily, they can be syringe fed their dose, but extreme caution must be observed to prevent aspiration of activated charcoal. Unfortunately, activated charcoal aspiration pneumonia is very difficult to recover from and can be fatal. We want to avoid it at all options. Another option would be to induce anesthesia, secure their airway with a cuffed endotracheal tube, passing a gastric tube, and then putting the charcoal directly into their gastric lumen. This is not commonly performed, but it is something that's recommended in cases of toxins that are very, very toxic and a high dose has been received, and that oral administration of activated charcoal is not something that can be happening. Activated charcoal can cause hypernatremia and electrolyte abnormalities, so we should always recheck electrolytes before subsequent doses and skip the next dose if hypernatremia is noted. Also, if at any point a patient's showing neurologic signs unexpectedly, electrolytes should be checked to make sure their sodium is not high and could be contributing to their neurologic signs. Repeat doses of non-sorbitol containing charcoal are often needed in toxins that undergo enterohepatic recirculation. So again, that's a toxin that's excreted through the bile and then reabsorbed through their GI tract. With some toxins, gastric lavage is indicated, And the one particular substance in which gastric lavage is one of the main ways we recommend decontamination is when a particular dog, cats don't tend to do this, but if they eat uncooked bread dough or yeast containing products, these products ferment in their stomach and then cause marked gastric distension, which can lead to GDV or gastric distension in volvulus. Also, the fermentation creates ethanol in their stomach, which can cause neurologic signs and hypoglycemia. In these cases, in dogs that ingest these large amounts of uncooked dough or yeast-containing products, gastric lavage is recommended to remove the dough from their stomach, but also we do that gastric lavage with ice water, and it stops the fermentation process because they like nice, warm environments, and when you put ice water, it stops the fermentation. So gastric or lavage, again, includes general anesthesia, a protected airway with a cuffed endotracheal tube, and the gastric tube is passed into the stomach. The stomach is then lavaged with water, or in the cases of dough ingestion, ice water, using a siphon technique of being able to remove that dough out of their stomach. The procedure can be stopped when minimal material is being returned and the lavage fluid is relatively clear. The next decontamination we're going to talk about is with ingestions of acid or alkali. This is something that's commonly recommended by poison control to dilute the toxin with water or milk. Again, we don't want to induce vomiting in these patients. Occasionally, an anti-inflammatory dose of corticosteroids may be recommended by poison control depending on what toxin they got into. When a pet gets into dermal toxins, or something that is contaminating on their skin, the decontamination should focus on early removal of the substance from the skin by bathing them with a mild soap such as Dawn dish soap is the most common way that we remove any dermal contaminants. If the toxin is caustic, owners and veterinary staff should take precautions to prevent their own dermal exposure. So if it's something that could burn your skin and is on a pet, it's something that you need to make sure that you're wearing gloves or appropriate PPE when you're bathing these pets, because it could then cause toxicity in our veterinary staff. Bathing can be repeated until residue or odor is reduced or eliminated, and take caution bathing neurologic patients and monitor for hypothermia. If it's a sticky substance, using oil, peanut butter, or vegetable oil are all things that can help to reduce that residue. So if it's something that's not coming off with Dawn soap, or if it's something that has like a very sticky substance, doing something like butter or vegetable oil can sometimes help to break down that residue. And then bathing afterwards is recommended to get that residue off the pets. Powders or dust should be brushed off or vacuumed off before bathing to prevent them from getting wet and then soaking into the skin or fur. If you have something that gets into a pet's eye or an ocular toxin, any possible ocular exposure, the eye should be flushed for 20 to 30 minutes with tepid water or sterile saline. Sedation may be needed for this process, as many cats or dogs are not going to let you flush their eyes for 20 to 30 minutes without giving a little bit of a fight. So in these cases, potentially sedation may be needed to really thoroughly flush their eyes. And you want to soak up any toxin to prevent dermal exposure under their eyes with a towel or gauze so you don't flush it from their eyes and then burn the skin under their eyes. We want to avoid high pressure eye flushing, just gentle flushing to prevent further injury to their eyes. And after flushing, you want to look for any evidence of corneal abrasions or ulcerations. If ocular chemical burns are noted, then lubricating eye ointments should be started and corticosteroid eye drops should be avoided at all costs.